Morning.
Morning, how are you? I brought some guests. Good, good.
Yes.
I brought some guests to see Dr. Gumede.
Okay.
Moses said I was going to partner and how to get you.
We try and come up with innovative ideas to help them, because I mean, their problems not only are health related, but usually there's always some kind of emotional, spiritual thing, financial especially. People come from quite rural, very poor backgrounds, and it's quite far for them to get here.
Okay, good morning. I'm Sangeeta Maraj. I'm from the KwaZulu-Natal College of Nursing.
Nhlakanipho Gumede. I'm the Chief Executive Officer and a Medical Manager for Pholela Community Health Center.
In doing the work of primary care, the ideas that you all gave birth to here have been very central to us, even as we now take it and reimagine it for an entirely new world in which technology, training, other workforce can really help us. But still, we have all of the issues of our patients to address, from HIV to TB to chronic illness to maternal infant care.
Interestingly, I think what I've noted is the fundamentals and the characteristics of the system that they use. It's the very same thing that we're trying to reinvent in this day and age. But my dream, obviously, is to get Pholela back on the map again.
Well, it is on the map in the United States. In the United States, you are famous.
I'm hoping that perhaps that would yield into this place being developed into a more innovative, like the one you have in the United States.
I think there's far more we have in common than differently, and so I was really interested in how, over these years,
immunization, of course, because it's children, and the future of any given country depends on how well the children are being taken care of. Therefore, if we can put more resources into child care as well as women health care, then probably the better outcome is almost something that we can expect in the future. You need to be able to know that in this community you've got so many households, and in those households there are many mothers, how many people are pregnant, how many kids under 5 are there, or even under 1 that are there, so that you'll be able to then each and every time when they don't come for immunization be able to go back and find them and immunize them. Without us doing that and waiting here for kids to come to us, we are playing a very dangerous game with them, because in the meantime we lose lives. Promotion of health is the mainstay of everything, and prevention is much as better as the cure is. So we cannot divorce curative medicine in South Africa because our nation is very sick. So people think that when you talk primary health care, you almost like divorce the need for specialists and you divorce the need for curative medicine. But as a matter of fact, they need to be balanced between the two. And over time, then it will shift. You will have more primary health care and less need for more specialized care. Because
and then we can really put what we need. 75% of the time, the patient does not need to go to the specialist. 25% they say, not to that 1% to consult to, but to a specialist. And so we've really sort of built this relationship, which I think is going to become standard of care, not for poor people, but for all people. Because nobody has time to go spend a day in the specialist's office, and I come home going, I don't really know. I don't know what I'm supposed to do. Plus, when the primary care provider gets that answer back, they have that conversation with the person they know. Here's the deal. This is what a hole in your stomach means. And the next time, if you keep doing what you're doing, or drinking, which is the thing that we see, you may die, because that hole is connected to blood vessels, and that's it. So this I think is one of the good uses of technology. Although, as one of our kids said, when his father was telling him about this exciting idea, he said, so, like, you use email to talk to somebody? This is a big deal? Why exactly is somebody giving you a big brand? When you think of it, it's so simple. And it is simple one-to-one, but when you organize it for a whole system, then it's a very sophisticated, wonderful.
How we see ourselves as a Pholela is we would want, as you were talking about education, nursing, and primary health care and all of that, we would want at some point to have a basis of nursing training here where people are being taught on primary health care in the very same history of primary health care. Which would give them a little bit more sort of like meaning to them, and then they would be able to socialize with the people in the area.